All right, everyone. Thank you so much for joining us. If we've not met officially, I'm Joel Harmeyer, and I'm the Executive Director of the Fort Wayne Medical Society. I've been in this role for about a year and a half. It's been as a Fort Wayne native, born and raised, and decided to come back here after college. It's been my absolute privilege to run the society with a storied history that has been in existence since 1839, before the Civil War, folks. So one of our member benefits that we have been doing is our monthly webinars. And at first we were talking about COVID exclusively, and we had some great chats about those. Those were well attended, and really I felt like we were on the cutting edge of sharing information. We had Dr. Scott Steinecker, who is our treasurer. He was sharing timely information through Parkview that was just a great benefit to our members. And we're keeping that momentum going with webinars. It's an 8-part series, and we're focusing on the whole physician. You know, our doctors have lives outside of the outside of work, and so over the course of these 8 chats, some are directly topics work related, some are wellness. Our last one was on nutrition on the go, which was very interesting. It is possible to quickly grab and go with some good food and not have to go to fast food if you don't have to. And we're just, you know, trying to give folks tips and just ways to, you know, round out their work-life balance. And a lot of our members are passionate about legislature, particularly what we can help dictate and steer at the state level. And so we are thrilled to have this chat here. Now, if in a non-COVID world, we would be at the country club one evening, we would all be enjoying some delicious food, possibly a cocktail. So this is a different setup for sure, but we do want to accomplish some of the same things that we do in that what we call our legislative workshop. And that legislative workshop has a long history of getting real legislature that was, you know, started as an idea in that room and then passed. So with that, just a quick word on the format, and away we'll go. What we wanted to start with was an update from the ISMA, and we want to talk about topics that they are focusing on. And then after that update, we wanted to get any specific topics that the members we have here today with us that are important to them. We just want to kind of lay out the whole thing and then have our legislators comment on that. So to get us started, we have Luke with the ISMA, and he's going to talk about what's going on in his world. So Luke, thank you for joining us, and the floor is yours.
Great. Thanks for having us, Joel. And thanks to our legislators and to all you guys for making the time to come and have this talk. So, you know, Joel, to your point about the organization being older than the Civil War, we were actually just having this conversation the other day in a different context. And somebody else pointed out that we are also older than 20 US states, as well as older than baseball. The anecdote was Cincinnati Reds. They were at the stadium and they saw a little plaque, and I can't remember the year, but it was 10 or 15 years after the founding of the organization. So going to be using the older than baseball moniker, I think, going forward. So to kind of get it kicked off with ISMA's focus, obviously, you know, COVID-19 has dominated everything from the healthcare space, economically, the elections, you name it. And so kind of approaching the 2021 session and our agenda from that perspective, kind of the 4 high-level buckets, and I think there's going to be some other issues that crop up that, based on what other people are working on, that we'll probably weigh in on. But I think our kind of big 4 will be telemedicine, which has been used obviously widely. You all know firsthand in response to the pandemic, as well as liability protections. There are a lot of folks practicing outside of their typical specialty. We have folks coming out of retirement to come and volunteer and help out, as well as students who graduated early or maybe were thrust up during residency into roles that they may not otherwise have been. So making sure that there's adequate protection there for those situations. Surprise billing, House Bill 1004 last year was obviously a huge topic for us, and one which I think everybody here is familiar with. And I think now that the dust is settled and we've had some time to think more about it, I think everybody realizes that it was a good first step, and there's still plenty more to do. I'm sure we'll hear from the legislators on today that about their thoughts on maybe what they see coming or what we might want to change. But we can go into that a little bit more depth as the conversation unfolds. And then finally, physician wellness. There is, everybody I think is familiar with the story of the physician out of New York who, after the first several weeks of the pandemic and the response there, unfortunately took her own life. And so that really highlighted the importance of physician well-being and mental health and access to services. And so there's a program out of Virginia that we're looking to model here and reproduce in Indiana, that gives additional supports to physicians who may be having mental health issues, or if it's a drug or an alcohol abuse issue that they may be afraid to come forward about for fear of licensure actions. This program sort of builds on top of the program that's already in place to sort of help get those physicians the help they need before it progresses to the point of something dangerous or that can impact their patients. So those are the kind of high level buckets. I can go into more detail if you like, or I would be happy to turn it over to our legislators.
That is a great recap, Luke. Thank you. And before we go to the legislators, let's just make sure if we want to have direct questions from any of our members here to add to the four things that Luke talked about, feel free to unmute yourself and jump in. So Luke, just to recap, telemedicine, liability protections, the surprise billing, and physician wellness. If we have any more from the members here, please join in. Anything we did not cover, and we can certainly, you can always type your question in the chat box. We can always take questions as we go. And with that, these four areas of focus that Luke mentioned, let's turn it over to our guests. And if you would introduce yourselves, please, before you speak, and just let us know if you're a part of any
Does everybody else have Joel frozen, or is that just
me?
Okay.
Maybe Joel was going to use the term relevant committees. I think maybe that's where he was going with that.
Well,
relevant.
There he goes.
There he
go.
Okay.
Oh, now he's.
Yep. I was trying to turn it over to you, Representative Lehman. So.
Sure. Well, thank you. On behalf of my colleagues, I want to say thank you for hosting this. The four things you touched on are things we've obviously had discussions with in the past. Maybe the wellness issue is a new one with what's going on with COVID, but and the liability protection has been out there for now a couple of months. I'm going to touch on that one. That's one probably I've had the most interaction with. It is a priority for us to put out some liability protections, not just in the medical world, but you're seeing that in a lot of fields right now that are saying, hey, we're going to come and look to see what kind of protections you can build around it. It is not as maybe as easy as it sounds, because I think there's a lot of moving parts to this, making sure we don't open up potentially problems down the road. At the same time, I think, Luke, when you were kind of teeing this up, the things that we think of are the people that are, I've retired and have come back. and so I'm putting myself out there potentially for some liability issues. And I don't want this to be something that I get pulled into over a situation where in the past we've never paid for disease because it's almost impossible to prove where you got it. So I know that we're going to have to deal with that. I think we're going to deal with that early. Kind of a sidebar is just to maybe bring everybody up to speed on what's going to happen this session. I think we have kind of finalized that where we're going to end up is going to be over at the government center. And then the Senate's going to stay in their chamber and spread out. But it's going to create for a lot of logistical concerns. It's going to be different sessions. So with that, we're looking at, the ability to do this very early, this liability protection very early, get this in, get this out, and move it to the governor so that we can then turn around and focus on the things that are going to be more the length of the session. From the health side, obviously telemedicine is going to be, it's expanding. It's continuing to expand. I think we need to make sure that we're putting in place the things that I'll defer. I know Senator Brown has been very active on a lot of these issues in the Senate. Surprise billing was a start. I think there were some parts in that were that could have gone a little farther. Maybe some that were looking out at the COVID situation are kind of glad we kept out of that bill. But that's going to continue to be, because I think you noticed throughout this entire election, whether it be on the state level or even the national level, cost of healthcare was an issue. It's going to continue to be an issue. We're going to have to continue to deal with that as to what really do we do to continue to drive the cost down to the end consumer, et cetera. So that's kind of a 30,000 foot view on some of these. I'll let Leader GiaQuinta and Senator Brown, I don't know if anybody else jumped on this from the legislature, to comment on their thoughts. But again, Joel, looking forward to working with you guys in Fort Wayne, and Luke, obviously more the statewide. You guys are well represented, and looking forward to a good session and a lot of input from your organization. Phil or Liz?
Thanks. Thanks, Matt. Or Liz, do you want to go? Go. Thanks, Matt. And Matt Lehman, actually, he's our Civil War expert, and I'm surprised he didn't realize that. Matt, I've never heard you mention that in your reading of history and your research of history that this group has been around since the Civil War. Did you know that, sir? Representative Lehman?
I did not know that, although I would say in my readings, I've never read about them. So I imagine they didn't have a real impact on the war. So the fact that they didn't play a key role on either side, I'll just let that one set.
All right.
I'll take it up with our historian and get back to you.
I think I'd stick with the earlier than baseball. That's a good one.
Thanks for just letting us come on here for a few minutes and talk just about issues that concern you and kind of what we're going to be seeing in the upcoming session. None of these are a real surprise. Speaking of surprise, none of them are a real surprise. I'm very interested to hear, and I'd like to actually hear a little bit more on the physician wellness issue. That some of these things, again, the ones the other topics certainly have been discussed in past prior sessions, and so again. Nothing new that these things would be taken up in the upcoming session, but physician wellness is something that might be maybe even new to me that I've not heard much about. So, and then I just kind of echo Representative Lehman's words with regards to surprise billing. Last year was a short session, so I think most of us would have liked to have seen maybe a little bit more of a robust bill regarding surprise billing, but we were up against the clock and in mid-March, so. While it was a start, I think we'd like to see, go a little bit further there. And, we have a little bit of a trial run, I think, on surprise billings. I think we've been able to see what's been accomplished so far with that past legislation and what needs to be improved going forward. So as Matt said, it'll be kind of a clunky session. I think Representative Lehman and I at least we'll be able to get our steps in this year, walking between the State House and the Government Center. Communication is going to be a little different and unusual, maybe more texting, things like that. I don't know, just because we're not going to be able to maybe see each other or be able to communicate as well as we have in the past. But and who knows, I think maybe at the end, in a typical long session, I was trying to calculate the number of bills that would maybe pass out of the House, and probably going to be, could be a little bit less this year, just because I think we're going to limit the number of bills that maybe not as filed, but probably heard, and it's just going to we'll just kind of have to deal with the session as we go forward and how things are going to work. But certainly these issues I know will be discussed, and we'll probably see some action on those too. So with that, I'll turn it over to Senator Brown.
Thank you all for having us today. I'll just jump right onto the topics that they've already covered and sort of give my 2 cents. I think with respect to telemedicine, it obviously has been particularly important with the shutdown, but I think going forward, we have to be very careful in what areas where there's a permanent expansion of that. It's good for some things, not everything. I certainly think in the mental health arena, I'm sure the sticking point will be what the reimbursement rate is. I liken this to the virtual school issue. And now that we have our traditional schools doing e-learning, we have to decide what the value is of a telemedicine call versus an in-person call. Liability protection, of course, is important. And I know there are several bills going through about that. Although I'm not sure I agreed with the comments initially about those who came out of retirement and volunteering. I mean, there are Good Samaritan laws that I don't actually know too many physicians volunteering, but certainly the liability protection would be appropriate because there were so many unknowns. Fortunately, the hospitals in Indiana were not as swamped as some of the other hospitals where they may have been triaging, but in terms of the level and quality of care, I certainly wouldn't want to extend any sort of protection if someone like a med student graduating early actually wasn't really up to the task. I don't think that's really what has happened, but I just put that out there as a caveat. I think surprise billing is, I might be an outlier. I think it is much more complicated than people realize. We've tried to define what emergency services are. We've tried to define or to determine whether or not an out-of-network physician or group or service should be in network, and if they're out of network, what the cost should be. I think the transparency that we have now, I think with the good faith estimate and people understanding what things are going to cost ahead of time, that helps on the one end. On the other hand, on the true emergency, my sense is listening to testimony in committees is typically the outliers were ER physician groups and anesthesiology groups, and they tended in a true emergency situation to work very, very hard with the patients to come to a resolution. But we had to be really careful of demonizing practices that are not part of these massive hospital systems, as if somehow they're the outliers. So that would be a concern. Physician wellness may be a concern, and I'm not discounting that, but I'm not really sure personally that that's an issue that the legislature should take up. So, and I don't have any other issues today to discuss besides those, unless there's something new that's.
Okay. Luke, that might be a good segue for a little bit more information on physician wellness. What are we looking to accomplish there?
Sure. So the current program, and I'm still getting boned up on this. So I guess I didn't lead with the, so typically you would see Grant Achenbach or me at these things, but Grant actually and his wife just welcomed their first child into the world 2 days ago, I think, or yesterday. So I was tapped to step in his place here. So, but on the physician wellness program, so currently there's the physician assistance program through ISMA that some of you or all of you may be familiar with. And there are similar programs in hospitals for those physicians who, you might have a substance abuse issue. And a lot of times they are only referred to those programs when there's a licensure action or a licensure action is pending. And so what you see in Indiana and across the country in places that have similar programs is that people are afraid to come forward. People are afraid to ask for help. And so the goal of expanded program, or I guess a program that's kind of sort of layered on top of the current program, would be to have something that gives physicians the opportunity to come from an anonymous standpoint without risk of having that licensure action, as long as they're not to the point where, you know, if they kind of nip it in the bud, I guess, where they get to the point before there's a real threat to patients. Because ultimately we want to make sure that physicians are practicing and they're healthy and they're not going to harm anybody in the course of what they're doing, or the course of their personal issues. So to your point, Senator Brown, about maybe that's not something that the legislature should take up. But it's going to be a very busy session on top of the alternate practices that we've been talking about in the Legislative Continuity Committee, and Representative Lehman kind of touched on. You know, the House is likely to be in the government center. We recognize that a lot of people are going to come to you guys with what their priorities are, and there's not going to be a lot of time to do it on top of, you know, the logistical issues, the budget, redistricting. It's going to be a busy session. So I think going into session, we recognize that might be one of the issues that we may have to, you know, push off into future sessions and keep working on and till we have time. So I guess logistically speaking, the program in other states has been through a state or county medical association would set up and pay for relationships with counselors. So I believe it's they would pay for when a physician is either referred by a coworker or voluntarily comes forward and says, "Hey, I need some assistance with X issue." Would come forward and has access to 6 paid counseling appointments with a counselor to work through, discuss their issue. And in most states, those are, I believe in Virginia, it's all through the foundation and fundraising and paid through dues through the organization. So I don't know that there's even a state appropriation. But I think from a state law perspective, the reason that a bill would be necessary is to make sure that those physicians have the anonymity and anonymity, I can't get the word out, and cover from the licensure action perspective. So again, to your point, Senator Brown, it may be something that we can push off into future sessions when we have a little bit more time and a little less going on in the world. But that's a little bit more detail.
Okay, I guess I just want to reiterate, though, what you're saying is local medical societies and foundations did the fundraising. And so when you say the issue typically comes at the point of licensure, if someone has a substance abuse issue that impairs their judgment as a physician, that's a different issue. But if someone is having, they're manifesting their mental health issues with a substance abuse or something, there is nothing that I'm aware of in current statute or with the licensing board that prevents them from seeking their mental health issues to be addressed. And I don't see that we need to delve into that area and pass a law that's going to address that. I think that the anonymity is already there. A physician or a healthcare provider is certainly more than able to go seek assistance in some form without having to alert a licensing board or something like that. I guess I'm really not getting this as an issue for us to look at.
Sure. Well, and so I think on the alert to the licensing board, and I may be mistaken on this, so please correct me, any of you practitioners, if I butcher this, but you know, if there's a physician who, like you said, has a mental health issue that's manifesting in a drug or alcohol issue, and they kind of come forward, those issues are referred to the licensing board, or at least the licensing board is usually made aware of them, and so physicians are afraid to come forward and ask maybe their employer for help, or they might say something to a coworker who would then feel obligated to tell the employer. So people will often suffer in silence. And so I think the idea is to give them another outlet to come forward without necessarily having their coworkers or their employers feel that obligation to go to the licensing board with a potential issue. I have plenty of information and write-ups and things that like I said, I haven't worked all the way through. So I'd be happy to share more of those with you, Senator Brown, and we can talk more about it. Because I'm really interested in your feedback.
We've got some good comments going in the chat function here. And I think that we have a group size that lends itself well to, if someone would like to add something at this point, just unmute yourselves and go for it. I think that we can all do that. I can tell you that the physician wellness, obviously we're doing 8 webinars on it, and it is the focus of our current president, Dr. Jefferson's year term, and it's a very important issue, arguably the number one issue here amongst our members at the society. So any more from anyone on physician wellness or any of the 4 topics we've laid out so far in response to our representatives and senator?
Yeah, if I could just, this is Dr. Sara Brown, if I could just expand a little bit more on what I put in the comments. So I believe every 2 years when we complete our licensing application for relicensing, one of the questions on there is, are you under the treatment of mental health? And that needs to be disclosed. So it disincentivizes physicians from seeking treatment for mental health issues, like just simple depression that is pretty prevalent given the stressors of the tasks at hand. And so instead of seeking help for that, oftentimes it seems that physicians suffer in silence, and that leads to physician suicide.
Dr. Brown, can I ask, when you mentioned about the renewal application for your licensing, they asked that question. Is that a question that if I'd answer yes, that I potentially would not get my license renewed? Is that the concern?
I think that's the concern, and maybe that's that there's not enough transparency in what really happens after the fact. But just the fact that you're asking about whether I have depression and expecting me to disclose that on a form seems to imply to me that I might not get my license renewed if I am under the treatment of a mental health provider for depression.
I should have added, I'm sorry, Senator Brown, but I think this will be particularly relevant to you. It's designed to be somewhat similar to JLAP, the Judge and Lawyer Assistance Program, in other states. I know they've worked a lot with, other with legal organizations to build out this program similar to that.
And hi, my name is Dr. Erin Jefferson. Just going off a little bit of what Dr. Brown stated, regardless of whether the perception is the same as the truth, I would say that the perception amongst physicians is, as Dr. Brown stated, that there's a fear that acknowledging mental health issues will have a direct impact on licensure. And anecdotally, I have the opportunity of working in GME with regard to residents and young learners, and that is a pervasive culture that I see even from early stages, because there's such a fear that people have spent so much time and financial resources to get their education that if they would admit to something like that and then it would cause an impact on their licensure, they're very fearful of that outcome. So thank you.
So thank you. I am familiar with the JLAP program. It's slightly different though, because of course, lawyers license themselves. So it's a little bit different. And I guess in the chat room, we're talking about licensure and credentials. So it's a little bit different. You're talking about private contracts between the employee and the employer and what they're asking of you. And it sounds as if when you sign a contract and you have to disclose whether or not you're seeing someone when your credentials are renewed with the hospital, that's an employment requirement or not. And that's something perhaps a physician signing that or any healthcare provider should explore more to see what that actually means and what they're required to do. For a licensure, are you suggesting is that the state medical board then requires that licensing? And again, I would ask, do you know that when they require that means you are thus restricted from renewing your license, or it's just something they need to know because they want to make sure that their physicians are capable in high stress situations, which they are, that they're capable of performing. So I guess I'm unclear what you're asking for then.
And we might have to unmute ourselves here as the Zoom refreshed and muted everybody. So
I don't know. I thought Dr. Pond was on the licensing board. I don't know if he's can speak or if he's in a environment where he can't.
we had Dr. Pond. Oh, there he is.
Actually, it's not. Yeah, Dr. Maston is on the licensing board. I know him very, very well. He's a good friend, but no, I am not on the licensing board, but Kurt is. And the question about mental health, though, we did look at this about a year ago, and Indiana is probably one of the more progressive states for allowing people to admit that they've had some mental health issues. The question is not whether you've had a problem, it's whether or not it will impact your ability to treat patients. If you'll allow me, I'll probably try to pull our files on that. And Joel, I'll get that to you and you can get that to our participants.
Okay. Well, and it seems when that Zoom restarted that we lost the chat function too. I had not seen that before. It looks on my end, all of our chat things are gone. Is that the case for you as well? I do remember Dr. Pond asked an interesting question for our representatives and senator joining us today. With COVID and its impacts, what does the Indiana state budget look like currently? Where are we at with that? It's been a lot of different changes, or are we on track? It was a question from Dr. Pond.
Well, I would say, I mean, just overall, it's had an impact. The positive is, I think Indiana was in a position to be able to absorb that blow a lot better than the states around us with our surplus. It's going to affect our revenue trailing a little bit. It'll impact the locals, not this year, but next year more. So it's going to be a very deliberate budget. I think it'll be very focused. We've already been telling our members, it's not the year to come and say, hey, it's time for me to get X, back in my district, et cetera. So I think it'll be interesting. I don't know that I don't think it'll be as bad as what some people have thought. But it will be a very different budget year than we've seen in the past. And Indiana did take a hit, like a lot of places did in revenue. And now we'll see what happens with the numbers kind of going back up. Are we going to see, again, some additional delays from some industries to want to get back as quickly as what we were hoping? So it's still, I'd say the jury is still out on what the end impact is going to be, but we have weathered the storm pretty good compared to our neighbors. I don't know if that directly answered your question. I can't tell you. I mean, I don't have the numbers in front of me as to how much we're down, but it's not good, but it's not horrible.
I think, Matt, we'll get updated numbers in December. And I know Senator Brown has spent a lot of time this summer on the budget committee, right, Liz? I think, yeah. So you might want to, you probably give a better update than I can, but yeah, certainly we'll get a better look here in December to see where things are going to go. And I think, Matt, you bring up a good point with the cases going up again, and could that kind of slow it back down again as other businesses have to take some other precautions with regard to serving patrons and things like that. So we'll just have to say. But Liz, I'll let you speak on that. You got a pretty knowledgeable on this stuff with your work on the budget committee.
I just tell everyone there's no money. There's no money. That's a simple answer.
That is simple.
That does not work with my wife. Okay, so at this point, let's open up the floor to any topic we've touched, or to expand on a current topic. We've touched on telemedicine, liability protection, the surprise billing, which we could go into that more as there was some progress made on that with House Bill 1004, and physician wellness. And with that, any other topic as we sort of head into our Q&A section of the chat. We have certainly a little bit of time to have it open. So just unmute yourself and fire away. And while we're thinking of questions, Dr. Pond reminded me, to our legislators joining us, that the ISMA has a board meeting this Sunday, and he asked if there's any relevant information you'd like him to pass along at that meeting, please let us know or email me. There's 6 of those meetings a year, so it would be timely if there is something.
Forgive me for being relatively naive on this topic, but I would love to hear your thoughts, Representative Lemon or Senator Brown, about non-compete agreements in Indiana and just what the stand is on this currently, and if that's been discussed much in recent times.
Yeah, and I think there was a bill, and Liz, you may know more on this. There was a bill last year, I think, that addressed some of that. I tell people I live in a world of non-competes. I'm in the insurance business, and we all have non-competes. I think and Liz, I'll let you talk on this. I think it was last year we had the discussion was, and maybe we ended up with something that was, we have to allow them to be able to get out of a non-compete. And so Liz, I'll let you build on that. Do you know more about that? Because I personally, like I said in the past, I understand, I can see both sides, to be honest. The investment I've maybe made and then turn around and, is that used to hold somebody, I can lock you in here. And I think there's some problems with that. I know, like in ours are not non-competes, ours are non-piracy. I can't keep someone from going out to compete, but what I can do is prevent them from taking clients with them when they leave, type of thing. So I live in that world. So I would say, I understand the topic. It's a little bit different in the medical world, I know, but I know we worked on this last year. I don't know where we really ended up, Liz. Do you know, or Phil?
The bill that passed was Representative Morris's version, essentially, which allowed them, but you had to have a buyout clause. Obviously, I had carried a separate bill, which would have banned them outright going forward. I'm not bringing that back, but I feel very strongly that it's, with all due respect, Representative Lehman, not like insurance. Patients can go wherever they want, but the problem with non-competes in Indiana, as we've seen the hospital systems get larger and larger, is they literally exclude physicians from whole geographical areas. And unfortunately, the difference is that some physicians in particular have very unique skill sets, and you could sue and prove that no one else can offer that skill set, or that you will be impacting the patient population by not allowing that physician to continue in practice. But that's a heavy lift. That's a lot of lawyers' fees, and most physicians aren't interested in doing that. My concern is then they leave the state and they leave the community where they're serving, and there aren't enough to go around. But quite frankly, I got to be honest, I don't really think the medical fields came strong enough last year to defend that. And I don't see a will to go back and redo that. Obviously, in my neck of the woods, there are some ugly lawsuits that have gone on with various hospital systems, and their physicians want to get out of them now. And now they are attempting to get out of them, and it's what they are finding is it's a prohibitive cost. And I'm just going by what I've read in the newspaper. So I think it is an issue as we're going forward with the lack of physicians, and of course they don't just cover physicians; they cover nurse practitioners and physicians assistants and things like that. So I think it ultimately hurts the communities because people will be very careful about where they plant their flag when they finish their residency, because if they like it, they're going to want to stay. And if they don't like the practice they're in, then they have to leave. And so I believe the bill that passed limits them to a year. I'd have to go back and check on that because some of them were longer than that. But it does not define what the buyout can be. It just says that there has to be one. And so going forward, what's going to happen is there'll be litigation in terms of what is appropriate if they didn't actually spell it out in their contract when they signed it. So.
Thank you for that.
Luke, anything to add on that?
Yeah, I was just jumping back in to see about the 1-year provision because I actually don't remember if that was in there, but you're right, Senator Brown, that it is silent on the amount of the buyout. I know anecdotally we've started sort of asking around, and data is pretty limited, but it sounds like there is some obviously some movement now that the provisions are required. I think we've heard kind of anecdotally that some of the primary care folks, a lot of those provisions have kind of settled around a 1-year salary, as opposed to, I think, emergency medicine, we've heard maybe around 2 years salary. We don't really have anything on specialists yet. We're still asking around on that, but we're working on some more solid feedback.
Anything more on non-compete clauses, the current topic we're on? And again, feel free, Dr. Pond.
This is a Pond here. Yeah, non-complete. If you make it a 1-year salary, and that's what I've heard, you've in essence driven the patient out or the doctor out of the community. No doctor can afford a 1-year loss of salary. So what he does, he leaves for a year. If he leaves for a year, we can't get him back. We need to look at what's best for our patients and what's best for the physicians, especially the new ones. In respect to Representative Wayman, I understand the insurance industry. The difference in medicine is if you get specialty certification, whether it's in surgery or anesthesia or other items, there's no place that you can go if everybody else has a non-compete. It's not where you can put out your shingle or go work for another organization. So they've got things locked up pretty well. Massachusetts does not have non-compete. Colorado does not. California, it's great for the physicians, it's great for the communities. The only people that don't like them are the businesses that want to control the market. So, the idea of putting in, there has to be a reasonable buyout. Yeah, but the reasonable buyout is it's a 1-year salary penalty. And if you don't like it, what's your option? If you got to litigate it, and docs don't have enough money to be able to litigate against a multi-billion-dollar corporation. Out.
So if I can ask, I know one of the kind of pushbacks was that we invest heavily in a physician's education, et cetera, or we'll pay off their school debt for them to come and work. If we were to ban non-competes, would that end? Would we lose some of those incentives? And if I'm a medical student coming out and I'm carrying a pretty heavy debt, would hospitals be hesitant to forgive those?
And Representative Wayman, I think you've got a good point. To the extent that we can have what's called liquidated damages. If you bring somebody to town and you pay off medical school debt, or if you pay relocation expenses, or if you invest in something specific, I think it's very reasonable that be recouped if they don't stay a year or 2 or 3 years. But that's not what we're seeing. We're seeing the doc who's been in town for 20 years, he wants to go part-time, or he wants to have a new service, and he simply can't do that. So I would agree with you. If there is an investment and loans are paid off, or if there's an incentive, then that should be paid back. So what I would like to see is prohibit non-compete, but also allow the business to recoup reasonably those expenses that have been acquired in bringing that person to town.
Okay, thank you.
Yeah, I think we have to understand there's a difference between the paying off a student loan or something like that. That's easily contracted for. But when you're really, as Dr. Pond said, inhibiting their ability to practice in the community, lawyers do not have non-competes. You cannot interfere with the attorney-client relationship at all. I can take my clients with me. And part of the bill, as I recall, with Representative Morris, actually spelled out what the practice or system that had the hospital physician working for them, what they have to say, because patients would call and say, I'd like to make an appointment with Dr. So-and-so, and they'd say, Dr. So-and-so is no longer here. Well, where are they? They won't tell you that. They could be across town, or they could be in Idaho because they left. But people, if they like their physicians, would like to go back to their physicians, and some have, again, unique skill sets. So obviously you could craft it. A non-compete's different from saying you have to pay me back because I paid off your loans. A lot of businesses do that when they hire MBA students. They will pay their loans or send them, and they have to work for them for 2 years. But this is different. And I go back to, as Dr. Pond said, they leave and they may not come back. And it's not just a young physician who comes to town and decides they don't like their practice either. We have lost physicians in this community more recently who wanted to go part-time, and the system didn't want them to. And that's a contract negotiation. But when they don't want to continue full-time and they aren't allowed to go part-time and they still have skills and they leave, then we've all lost. And that has happened as well. And there's nothing we can do about that. So, and it's not an issue with the hospitals not being able to recoup their investment. They will always say there's goodwill, but at the end of the day, the physicians who have left for a year and come back and they've gone to a different system, you will find many of their patients will follow them if they can, but let's be honest, it comes down to their insurance coverage. So if they're still insured, the patient at the next place where that new physician transferred to, then they'll continue on. If they're not, they'll be sad, but they'll go where they're covered. So.
Luke, anything from the ISMA's perspective on that?
Yeah, I mean, that was echoed a lot of the debates and the arguments we've heard. You know, from an ISMA perspective, we have members who are on kind of both sides of the fence of the outright prohibition, and then other folks who, you know, who are a fan of the reasonable buyout, and so obviously puts us in a bit of a interesting position. So without rehashing old arguments, I guess.
Anything else on the topic?
Yeah, just as a little bit of additional background, it is the official policy by the House of Delegates of the Indiana State Medical Association that there should not be non-compete clauses, and they consider them legal but not morally ethical. We do have certain people in the ISMA who have a financial interest in keeping them in place, and they have undermined that policy of the ISMA on occasion. But it is the official policy of the House of Delegates of the ISMA to prohibit non-compete clauses in the state of Indiana.
Anything to add to that? Luke?
I guess I'll just defer and say that you know, being relatively new to ISMA at the time, I was not as heavily involved with a lot of the internal stuff that Grant was handling at the time. So I know there was a lot of talk, to Dr. Pond's point. Unfortunately, I just don't have as much as much background and experience of, you know, of that. So I apologize for that. I'm coming to the point where I can't use the new guy card anymore because it's been about a year since I started with ISMA. So I'm going to take advantage of it when I can.
Fair enough. Fair enough. Okay, let's go for a last round of questions here. We're rounding. We're on the home stretch here. We like to keep these to an hour, if at all possible. Any last questions or comments for the folks joining us today? I feel like Dr. Chang has a question. Oh, Dr. Brown, thank you.
Sorry, I do have just a few comments. So I think the one thing we didn't talk about with the liability protection, and that is somewhat scary as we move forward as a physician providing emergency care, is that the protocols have changed pretty rapidly over the last 6 months and continue to do that. I mean, as we get more and more patients every day or every week, there's a new email about do this differently, do that differently. We're now going to start using this medicine earlier. We're going to use that medicine later, or we're not going to use that medicine. The new studies say it's not helpful. The new study says it is helpful. And so it's just challenging to manage those patients and be on the front line of that and worry that in 3 years, there's going to be a lawsuit that says, well, you didn't do this right because you didn't give this medicine fast enough, or you gave this medicine and it was proven that it wasn't helpful or it was harmful. And those things are just kind of challenging to be on the front line and try to stay on top of what's going on today, as opposed to what was the right medicine a week ago. So I just wanted to throw that out from a liability protection standpoint. That's one of the challenges that we face every day. I certainly agree with Senator Brown's comments about the telemedicine thing. I think that, telemedicine is great, and moving forward, I'm excited to see that telemedicine will be more a part of our future than it was a part of the past. But I do think it needs to be well crafted. I mean, the pot of dollars to provide medical care is not going up, right? And we still want to provide the best medical care possible. And I think, we've been forced to do some, I mean, I've seen phone calls being a telemedicine visit, and I'm not sure that that's really appropriate. It may be if you can't do anything else and you don't have any other options, but that doesn't mean that that's great medicine in 5 years, that a phone call is the same as an in-person visit. So, and I think I certainly appreciate your comments, Senator Brown, that we do need to be careful about how that moves forward. So thank you for that.
Yeah, I want to support that. I apologize. I missed the first few minutes of the conversation, but I feel that telemedicine is the future. And in fact, this is something for the community, because Dr. Brown, I agree with you, because oftentimes for a whole day, 30% of my patients actually, they don't even have video. So it's very hard to really do a good job on the telephone for patient care. So understanding that this is a bigger issue, because again, we only have limited resources, but just my own clinical experience seems to me that this is something we know it's a future. And in fact, even before the COVID, we're thinking for neurology, that is going to be the goal for 2021. Before we know it, within 1 week, we transformed into telemedicine, like 80% of what we've been doing. And so I guess from an infrastructure standpoint, this is not just for medicine, because for education as well. There's still a lot of people perhaps can benefit from some support from various reasons. I'm not asking to say this is the responsibility of the state or the legislator, but it just seems to me it is still a problem, and doesn't seem to be improving. Like I said, I'm still having days, 30%, 40% of the patient, they have no connection. And so the only option we have would be a telephone evaluation. So again, in many ways, I really appreciate it. I think our legislator has been great listening to us, and I just want to indeed also thank you all that willing to listen to us, and so we can work together. So want to say thank you to talk with us.
And I will, that's a great segue, Dr. Chang, for me to thank our legislators, Representative GiaQuinta, Representative Lehman, and Senator Brown. Just want you to know that we have an active, thriving society here in Allen County and surrounding areas. And we also have a very good email list connected directly to our members. So if I or our board may be of any service to you, please reach out, because we appreciate the ongoing dialogue and we can also help disseminate information, critical information to our members quickly. Just another quick anecdote, during the COVID crisis, across hospital systems, folks were relying on our daily emails about COVID, because what we did was we took all the information and aggregated it into one spot, what the ISMA was saying, what the Indiana Department of Health was saying, what the Allen County Department of Health was saying, and then sent it out to our members. So we have a good line of communication going here. And just in closing, we look forward to the day soon, and we know that the day is coming when we will be able to meet in person. And Zoom is great. It's just it's not the same, and we want to gather in the same room like we used to, and really hash some of these issues out and get some things moving forward. Dr. Pond is a wonderful catalyst for all that stuff. So stay tuned, because in 2021 we intend to have a legislative workshop at some point again in the future. So thanks to everyone for joining us. We are very appreciative of your time. Luke, you stepped in like a superstar. You did an awesome job. Thank you so much. It's always awesome, terrific to have the ISMA's perspective. So I wish everyone a wonderful afternoon. It's a beautiful day outside. Let's go for a walk, and we'll see everyone next time. So thanks again, and I'm going to stop recording.
Thank you, everybody.
Thank you all very much. Superstar was generous, but thanks for having me.